Hello, my name is Tanisha Bradley and this is my Unit 18 Health Promotion. What is health promotion? Health promotion is when an individual is given advice, help and resources to boost both their life skills, lifestyle and overall health. There are multiple different health models, such as the social model, social ecological model, the health belief model, the social cognitive model, and the stages of change or the trans-theoretical model. The social model. The social model focuses on the factors that impact an individual's health. This can include restricted access to healthcare, social relationships, and financial stability. When the social model is used, it allows professionals to understand what factors affect the individual and help prevent them and avoid any health inequalities. The social ecological model. This focuses on the individual's environment and helps them understand links between both the individual and the environment they are in. The social ecological model theory was developed in 1977 by Brophy-Benner, which consists of a diagram showing the different factors that influence an individual's behaviour. This diagram allows professionals to make connections which can affect the individuals both negatively and positively. Some factors include age, education and income, the relationships between friends, family and their work, the community they live in, and cultural norms. The health belief model. This was created in 1950 by social psychologists. This gave a better understanding and helped them to foresee an individual's behaviour towards their health. It focuses on how an individual responds to a disease/condition, the behaviour and how easy they can be influenced by both the media, family and friends. The health belief model is split off into a table. The table consists of perceived susceptibility. This is how likely the individual is to develop a disease or health condition. Perceived severity. This is how the individual reacts to receiving the news of being diagnosed with either a disease or a health condition. Perceived benefits. This is how the individual responds to possible treatment and how effective they are. Perceived barriers. These are the setbacks, such as not being given enough support and not being able to have the treatment based on their financial situation. Cues of action. This is how an individual takes action based on internal factors such as experiencing more discomfort and the external factors such as attending appointments and researching information on their condition. Self-efficacy. This is an individual's belief if the cue of action is not successful or not. The social cognitive theory. This focuses on how the environment around you affects how you think and your behaviours, as well as how you process information. The social cognitive theory includes modelling. This is when an individual sees someone act in a certain way and they mirror the said action and behaviour. The stages of change. This is a six-stage change model which was created by psychologists in the 1960s. It was created to help support individuals with their drinking habits. The theory suggests if an individual recognises the issue and wants to change, then it can help them then this can be applied. The 6 stages. Contemplation. This is when an individual is in denial about the issue. Contemplation. This is when the individual decides if it's worth making a change by weighing both the positives and negatives. Preparation and determination. This is when an individual decides what changes they will make and what support they need or want. Action is when the individual starts to make noticeable progress. Maintenance, when an individual has taken action for a long period of time. Relapse/termination. This is when an individual has gone backwards in progress and has to decide whether it's worth it or not. This would also mean them starting from stage 1. The health belief model and the stages of change. The strengths and limitations of the health belief model. The strengths include it's person-centered and can be tailored to the individual and the situation. It can be used for multiple different diseases, lifestyle choices, as well as being used by multiple professions. It gives a clear guideline on how the individual reacts to the situation. The limitations. The health belief model does not take into effect environmental factors and how they influence them. It also doesn't acknowledge the individual's personal beliefs, as well as it being hard to predict an individual's response. Strengths and limitations of the stages of change model. The strengths. The stages of change model focuses on an individual and when they are willing to accept to make a change. It is clear to follow and shows an individual's progress over time. The limitations. It doesn't take in effect social factors, as well as the pre-contemplation stage and the contemplation stage are arguably the same, not giving a clear differentiation of the differences. Comparison of the health belief model and the stages of change model. They both focus on how important it is to change behaviours and promoting health. Both understand that behaviours can be influenced by the individual's social setting and the environment around them. Both recognise the need for interventions. The differences between the health belief model and the stages of change model. They focus on different concepts and have different approaches towards health promotion. The health belief model focuses on an individual's risk and self-confidence, whereas the stages of change focuses on the individual's willing to recognise the issue at hand and makes change. The effectiveness of these models. Health promotion models can be used to have a positive attitude around health behaviours. However, it depends on a number of factors such as what health promotion is being used, who is it aimed at, how the model is being used, and what setting the model is being used in. Things to consider. Health promotion models uses both direct and indirect observations, meaning they have a better understanding on different behaviours, allowing them to be customised to the individual. They take a tailored approach by getting to know the individual and their needs to achieve the best possible result. They change behaviours to more positive ones, such as setting realistic goals and having a support network in place. Maintaining long-term behaviour changes which can lead to improvement in health rather than using short-term fixes. Health Promotion Initiative, Change for Life. This was launched in 2009 to help tackle obesity and educate about the risks it can lead to. The initiative was originally aimed at parents with children between 5 and 11. Their goals included alerting families to how much sugar is present in food and drink and the dangers of having too much and what health conditions come with this. They used customized approaches to suit each individual and family. They allowed easy accessible support via the Sugar Smart Free app, which allows you to scan food and drink to see how much sugar is in the item. They also promote parents to buy less sugary food and drinks and opt for the lowest sugar, sugar-free or natural sugar options. Their aims and objectives: encouraging people to eat 5 fruits and vegetables a day by swapping foods out and hiding fruits and vegetables in foods such as homemade sauces and soups. Using the 400-600-600 approach to monitor calories throughout the day. They suggest that you should have 400 calories for breakfast, 600 calories for lunch, and 600 calories for dinner. They also encourage you to watch your salt intake and know the risks, what it can lead to, as well as encouraging to swap to the reduced salt or no added salt versions. The limitations: it overlooks a family's financial situation and whether they are able to afford more healthier alternatives. The initiative can also have a negative impact on body image and can lead to eating disorders in future due to highlighting bad foods and counting calories, as well as individuals may not have access to smartphones or internet to use the app. How effective is Change for Life? The initiative used a number of ways to boost their audience, such as social media, school workshops, TV adverts, and a user-friendly app. This saw 413,466 families sign up within the first year, with 44,833 of them still actively using the app 6 months after sign up. The feedback was positive, with families saying they had seen a noticeable difference in their child's behaviour whilst doing food swaps. It also received 1.9 million responses on multiple platforms within the first 12 months of launching. What role does agency and organisations play when improving public health? They raise awareness and educate the public to have a better understanding on the possible health risks and how to prevent these. They ensure that everyone has access to healthcare. They put rules and regulations in place on certain products such as tobacco and alcohol sales. They analyse data and research current strategies to see if they are effective or not and change them accordingly. Public Health England helps promote healthy living. They achieve this by monitoring and researching current health trends, offering advice and support on ways to improve your health, as well as addressing your health issues and concerns. They also help tackle equality, making sure everyone has access to healthcare. Limitations of Public Health England: not giving enough information to the public at times of need, such as pandemics and natural emergencies, budget and funding cuts, as well as the strain on healthcare settings due to not acting fast enough to their needs, leading to short staffing and not enough beds and resources. How effective are these agencies? They monitor disease breakouts, mortality rates, quality of life, and life expectancy to see if there's a pattern and what can be changed. They carry out research such as surveys, focus groups, and questionnaires to see how the public feels and what needs to be changed. They also monitor if the public are willing to participate in spreading awareness. In conclusion, health promotion allows individuals to have a better understanding and control on their own health and health behaviours. It allows individuals to feel like they have a voice regarding their health needs. Thank you for listening.